In a recent statement by the South African Human Rights Commission, it was highlighted that, constitutionally speaking, access to free healthcare should extend to illegal foreigners residing within South Africa. Specifically under Section 27(1) of the Constitution of the Republic of South Africa, everyone has the right to have access to healthcare services, including reproductive healthcare. With the ANC pushing hard for the implementation of the National Health Insurance Bill, the impact that this would have on South Africans would be catastrophic. Illegal immigration had long been a problem in South Africa. Long before the ANC took power in 1994, foreigners had been flocking to South Africa from all over the African continent. In 1984, under President P.W. Botha, the National Party introduced tight labor migration control to combat the influx of economic migrants to South Africa. By 1996, very soon after the first democratic election, the Minister of Home Affairs, then Mangosuthu Buthelezi, made the statement that there are more than 1 million foreigners committing crimes in South Africa. The same minister later, in 1997, claimed that his department estimated an illegal population at between 2.5 million and 5 million people, further stating that it is obvious that the socio-economic resources of the country, which are under severe strain as it is, are further being burdened by presence of illegal aliens. The cost implication becomes even clearer when one makes a calculation suggesting that if every illegal costs our infrastructure, say, 1,000 rands per annum, then multiplied with whatever number you wish, it becomes obvious that the cost becomes billions of rands per year. Remember, this was in 1996, when the rand still traded against the dollar at less than 4 rands per dollar and the price of petrol was 1 rand 88. Thus, billions had a completely different meaning in those days. Getting a more recent number on the amount of illegal foreigners in South Africa is very difficult. The last official statistic was with the 2011 census, which counted 6.2 million foreign-born residents. However, it had been criticized as not counting the total number. In 2023, the political party Action SA claimed that the amount of illegal foreigners are higher than 15 million. This claim is, however, unverified as no good statistics exist, and Mashaba came under fire from mainstream media sources for making this claim. That being said, if a more conservative estimate is taken at 6 million, the economic impact of the SAHRC statement is catastrophic. In this video, we shall analyze what this means for ordinary South Africans like you and me. Good morning, dear friends. This is Willem Petzer speaking. For more analysis like this in your own interest, feel free to click subscribe on both our English and Afrikaans YouTube channels. You can also receive free updates about our work on WhatsApp by simply sending your name and surname to the number on the screen. Furthermore, you can sign up to become a paid member of our exclusive club. Also do that on WhatsApp by simply sending "Sign Me Up" to the same number, and we will call you and explain the options and benefits. This is the bread and butter of our media company, and we would greatly appreciate it if each of you would consider it. Earlier this week, the South African Human Rights Commission issued an astounding statement claiming that all illegal aliens in South Africa qualify for the same public benefit healthcare services as the citizens of this country. In appealing to Section 27(1) of the South African Constitution, it has claimed that all people in South Africa, regardless of nationality, legal status, race, gender, age, income level, or geographic location, are entitled to basic healthcare services, including documented and undocumented migrants. This statement sparked outrage and was strongly condemned by political parties such as Action SA, which noted that if this became established practice in South Africa, it would place immense pressure on an already overburdened system. They furthermore cited instances where over 70% of patient records at some Johannesburg clinics are those of foreign nationals, noting that South Africa's constitution must reflect the reality of our limited capacity. If this 70% figure is true, It would give some substance to their claim that illegal foreign populations in South Africa could be as high as 15 million. Numerous people from all ends of the political spectrum immediately expressed their extreme concern and objections to the statement by the SAHRC on social media, with some even calling for the organization to be investigated and disbanded altogether. That these calls are now coming from the left wing is quite ironic, given the fact that the SAHRC, established by the Human Rights Council Commission Act of 1995 as mandated by the South African Constitution, Section 184, states that the Commission has to provide A. promote respect for human rights and culture or human rights, and B. promote the protection, development and attainment of human rights, has long been employed as a tool to prosecute and suppress anyone who dissents from their ideology, upon which the whole multicultural project of modern-day ANC SACP South Africa is based. And also C. assess the observance of human rights in the Republic. The Commission's interpretation and application of this mandate, however, is evident in the way that has long been employed as a tool to prosecute and suppress all who dissents from their ideology. For example, when a Cape Town church preached on biblical mandate to spank children as a form of discipline, they were condemned as promoting unconstitutional practices by the SAHRC. At the time, the congregation gained a signed support of over 11 million South Africans in their fight against the tyranny of the SAHRC, but of course at that time the investigation was championed by many on the left. Now the tables are completely in the other direction. By simply continuing on the same path and the same tyrannical application of South African human rights law, the Human Rights Commission have now invoked the wrath of the left-wingers as well. And the fact of the matter is that Action SA is right in pointing out that the limited capacity of our already constrained medical system does not allow accommodating millions of foreigners. But at the heart of the problem that has been brought to light by both the Human Rights Commission statements as well as the near universal opposition towards it is that the Constitution is a mere document that does not have any power to actually deliver on its promises in South Africa. It may promise the stars to the people of this country, but if an incompetent government fails at delivering the services mandated by the Constitution, the words on paper really mean nothing in practice. In South Africa, despite our Constitution, the people of this country suffer more than ever before under government incompetence and mismanagement today. And it is this very government that cannot deliver textbooks to schools, that cannot maintain even the most basic infrastructure needed to ensure that taps have running water, and a government unable to provide any quality healthcare in this country's existing public hospitals. This same government now wants to implement a national health insurance system. An analysis by Moonstone and Discovery has concluded that the funding for the NHI stands at approximately 200 billion rands a year, which is the equivalent of just under 10% of the state's tax revenues, which was in that year, 2024, it was 2.155 trillion rands. This number does not include a projection for funding healthcare for foreigners, which could be higher than 10% of the population in South Africa, conservatively speaking. Furthermore, with real GDP growth in recent years to 1% or less, given that the South African economy is in dire straits, raising taxes to support NHI may further weigh on growth and employment in this country's economy. The fact of the matter is that South Africa cannot even support its own citizens anymore. It has taken many years to erode the infrastructure to the point where economic growth becomes stagnant. Furthermore, the rampant spending of the ANC and loss of public funds to mismanagement, to incompetence, to corruption drove South Africa to the point where it already has to loan money to only survive its own budget. We did a video on this yesterday on our Afrikaans channel. With BEE stifling the economy and driving away international investments and newly implemented tariffs and international pressure piling up on the ANC to drive manufacturing out of this country, as we saw recently in the case where Mercedes-Benz pulled their factories out of East London, the ANC must reassess its commitments to socialism. It must face the reality that it simply ran out of other people's money to spend. Thank you very much to each of you who have watched. If you believe in our work, it is crucial to support us so that we can continue with our work by joining the Willem Petzer group. For more information, WhatsApp sign me up to the number on the screen and we will get back to you. Goodbye and God bless you.